Hello, CISW members and anyone that is tuning in with us today. Thank you for joining us for another webinar. We're so happy to have you wherever you are, wherever you're at. Thank you for coming and spending an hour with us. We have another amazing continuing education opportunity for you. This is one that's really important. I mean, all of our webinars are really important, but definitely within this current climate, we are excited to be able to welcome an incredible organization to co-host a webinar with us. So I'm so happy to be here. I'm in Ottawa. Actually, we're both in Ottawa. Both of both presenters are in Ottawa today. It's a little rainy. So it's a nice day to kind of get into some continuing education and spend some time asking some really engaging and honest and open and inspiring questions and conversations. So before I get into what the webinar is going to be about and our incredible webinar presenter today, I'm just going to do a couple little CISW housekeeping notes. As always, if you are a veteran on this platform, just disregard me for a couple minutes. If you're new, welcome. We're so happy to have you. Note that our entire platform is completely customizable. So take a couple minutes and make sure that it's the best viewing experience for you and for your learning needs. You can make the slides bigger. You can make us bigger. You can maximize, minimize, anything you want. So just take a couple minutes and see kind of what feels right. Note that the question and answer box should be open on your screen, but if it isn't, you can click any of the widgets at the bottom. Try and have the question and answer box open. If you have any questions throughout the presentation, I'm here to moderate. We also have a tech online, so if you have any tech questions, we will be good. Just type any of your questions in there at any point when they come to you, and we'll compile them for a formal Q&A, question and answer at the end. As well, for anyone here who needs to access their certificate of attendance, that should be the little yellow widget that should be on your bottom widget hand. Those certificate of attendance are available after you do about 40 minutes of the presentation. You can also log on after the presentation is complete and access those certificates if you have any problems accessing them today. Sometimes they're kind of hard because depending on your computer screen and the size of your screen, they hide. So just try opening and reclosing them if you have any issues, or try logging back on, I would say about 24 hours, depending on your internet connection after the live performance. So I guess with all that being said, we can jump right in. I am so excited to jump right in. This is a topic that, like I had mentioned before, the CISW has been watching very closely, and something that I know social workers across Canada have been working towards. The presentation today is titled Keeping Survivors Safe and Healthy, Violence Against Women's Shelters Response to COVID-19. So we are joined today by Leah Stewart-Shepherd. She is the Knowledge and Exchange Coordinator at Women's Shelters Canada. In this role, she creates opportunities for shelters and transition houses across the country to connect with each other and share their knowledge, promising practice, and resources. Leah's background is in adult education and community development, with a particular focus on experiential education and learning by doing, which is probably a lot of our social workers on this call as well. She's passionate about participatory, community-based approaches to social change. So thank you so much for being with us, Leah. I'm so excited to have you here. Take it away.
Awesome. Well, thanks, Alexandra, and to the Canadian Association of Social Workers for inviting us. And thanks to everyone who's here tuning in today. I'm really excited to be here and to go through this conversation with you, and hopefully, you know, it's a webinar, but hopefully we'll have a chance to kind of get to know each other a little bit too. We have some polls throughout the presentation, and I'm looking forward to your questions also. As Alexander said, today I am talking about VAW shelters and transition houses and how they're kind of adapting to the COVID-19 situation to make sure that they can still provide services to survivors and keep them safe and healthy, as the title says. So what I'm going to do today is start with a bit of an introduction to Women's Shelters Canada, just so you know a little bit more about who we are. I'll give you a bit of an overview of the VAW shelter sector. For those of you who maybe aren't as familiar with the sector, it'll just be a pretty quick kind of get to know it. I'll talk a bit about COVID-19 and domestic violence. How is it impacting the domestic violence situation globally and in Canada? And then I'm going to focus on three particular areas of shelter practice, I guess. So looking at how are shelters continuing to support women and children in the community, so who aren't in the shelter, but maybe need some support. They're experiencing violence or they have formerly experienced violence. How are they providing physical shelter to women who do need to leave a situation of violence? And how are they supporting those women once they're in the shelter? And, with all the isolation and the restrictions that are going on at the moment. So to start with a bit about Women's Shelters Canada. So we are an organization, a not-for-profit that was created in 2012-2013 by the provincial and territorial shelter associations. So those are the associations at kind of the regional levels that represent and work with shelters. And so they decided it was important to also have a national voice at the kind of national federal level for violence against women and VAW shelters. So that's us. And so we work with shelters and shelter associations across the country. And our work includes research and policy. And so on that front, we really try to do kind of some research and some advocacy to make sure that the policy that's getting created that impacts shelters is informed by shelters, so that it aligns with kind of shelter needs is the ideal scenario. We also do advocacy, obviously, as part of that. One of the big pieces we're advocating for at the moment is a national action plan on violence against women, to make sure that there are comparable levels of protection and service across the country, because right now, unfortunately, there are a lot of regional disparities, and so depending on where you are, you maybe have less access to services. And then knowledge exchange, which is my domain. And so we also do our best to create opportunities for shelters to connect with each other and share what they're doing and how they're solving problems and coming up with innovative, promising practices in their shelter, because we believe there's a lot of expertise within the sector, but sometimes we're working in isolation. And so if we can connect with each other, then we're able to really pool that knowledge and strengthen the sector as a whole. And like I said, and like Alexander said, that's my area of work. So I'm excited to be here today, too, to exchange some knowledge with all of you. Specifically during COVID-19, I want to just highlight a few of the knowledge exchange activities we're doing, because they might be useful to some of you. And so we're having regular meetings with our provincial territorial shelter associations, obviously, to stay informed about what's happening on the ground, issues we need to be aware of. We've been compiling practices and resources in a Google Doc, and so that's kind of public for people to see if you're looking for pandemic policies for shelters, resources to keep kids occupied while they're in isolation. We have a compilation of all sorts of different practices and resources. We also have a resource page on our website, and we have a few webinars that we've done as well, which are on our YouTube channel. And the PowerPoint is hyperlinked, so hopefully you're able to access those. But if not, I can provide links. And so I do want to kind of highlight or acknowledge also at the beginning here that I'm not a frontline worker, and we're not a shelter. And so what I'm sharing today really is kind of a global perspective of what's going on in the sector in Canada based on what we're hearing through these knowledge exchange opportunities from shelters across the country. So it's not based on sort of a personal experience working at a shelter. Cool. So now that I have introduced myself and Women's Shelters Canada, I'd love to get to know who's listening in today. So there's a poll up now, hopefully. And if you could just take a few seconds and let us know what sector you're working in.
So if you don't see the poll, just make sure that your slide deck is up. So that should be the slide function on your control panel. And if it's other, please type other and then let us know in the Q&A what it is that you do.
Awesome. So I'll advance to results. Hopefully most of you have had a chance to take a look at that. So looks like we do have some people here from the VAW sector, so that's awesome. Mental health sector, well represented, child and youth work, lots of others. So definitely let us know later on what sector that is, because that would be really interesting to know. But that's great. I'm really excited. There's kind of a variety of sectors represented here. Hopefully we'll have some really interesting questions and conversation coming from that. So without further ado, I'm going to jump into the meat of things. So the VAW sector in Canada. What is a shelter, or a VAW shelter, first of all? Let's start with basics. So we at Women's Shelters Canada, we consider a VAW shelter a facility whose core mission is to offer services and supports to women and children who are escaping violence in a residential setting and through outreach. And so there's a few components there. It is a residential setting, and so we're not talking about a resource center or crisis line, or organizations that only offer crisis lines or resource centers. There is a residential component. There's also a lot more than that. So there could be a crisis line. There could be an outreach service. You don't have to stay in the shelter to access those services, but there is that key kind of sheltering component. There's probably people here from lots of different places around the country. And so just to highlight that there are a lot of different terms for a VAW shelter. So if you call them a transition house, a safe home, a family violence shelter, domestic violence shelter, that's what I'm talking about, but we have chosen one term to go with for today because it's a little easier. So there are two types of VAW shelter. There's emergency or first aid shelters, and those are probably the ones that most people would think of when you think of a shelter. So they offer short-term shelter to women in crisis. It could be days, weeks, months, a couple of months, depending on where you are in the country, really. And it's generally shared or private rooms with communal living spaces, like a communal kitchen, communal play area for kids, that kind of thing. And there's about 428 of them across the country. There are also second stage shelters, which offer a longer-term transitional housing for survivors, and particularly for those who maybe they need additional time to heal from trauma, or they're facing barriers finding permanent housing or independent housing on their own, or they're at particularly high risk of danger in their post-separation journey, and so they maybe need a little bit of a more secure environment for longer than a few months. And so that's what second stage would be for. And in this case, generally women would have their own units, apartments, so it is a bit more independent, but they do still have the access to supports and services that you do in an emergency shelter. There's fewer of those, about 124 across the country. And I kind of already alluded to this, but just to emphasize really that shelters are much more than a bed, which you'll hear me say a few times because we have a report called that. So in addition to physical shelter, VAW shelters offer crisis lines, risk assessments, safety planning. They offer individual and group counseling and programming for women and for children, support navigating all of the systems that a survivor might come into contact with, so social assistance, the justice system, immigration, housing is a huge one, child protective services is another. Most of them also have some kind of prevention or awareness component or outreach program, and lots more. And it varies a little bit at every shelter, but there's lots going on. So before getting really into the COVID-19 angle, I just want to look at a few kind of existing factors in the sector that are affecting the response to COVID-19. And so there's a few challenges I want to highlight that are being exacerbated right now or making it harder for the sector to respond. And so one of those obviously is a lack of funding. And so like I mentioned, we did put out a report last year called More Than a Bed, and it's a comprehensive profile of VAW shelters across the country, which was put together with shelters and focuses on shelters themselves, not sort of the women they serve necessarily. So it's a little bit different than some of the other studies that are out there, but there's lots of interesting info in there, and if it's something you want to know more about. But one of the things we found there, it kind of affirmed what we knew about the underfunding in the sector. And so 74% of respondents said that insufficient funding is a major challenge. And so that's pretty significant. And most shelters, so 64% of shelters also said that they don't receive an annual cost of living increase from their main government funder. And so if you're not receiving a cost of living increase, functionally, your funding is going down because it's not keeping up with the cost of living. So that's not good. And so as a result, most shelters have to do quite a bit of fundraising to fill the gaps that are left by that insufficient government funding. And so that does mean that going into COVID-19, where the adaptations mean some of the costs are going up, that's a little bit of a precarious position to be in. I also want to highlight a lack of capacity in terms of shelter spaces. And so in our report, we also saw that 41% of respondents said that capacity was a major challenge. 36% said it was a minor issue. So it's pretty widespread that shelters are sort of full most of the time. And one of the reasons for that is a lack of affordable housing across the country, which I'm sure is not a surprise for anyone listening. But the challenge with that, with shelters, is if women who are in the shelter can't find safe and affordable housing to move into, then they can't leave the shelter. And so that means there aren't places for other women to come into the shelter. And so there's a bit of a bottleneck there, which is a challenge. We also have Shelter Voices, which is a snapshot every year of shelters. And we've found a pretty consistent turnaway rate the past few years of about 75%, which means that on the snapshot day, shelters have had to turn away 75% of the requests for shelter, which is huge. And I want to be very clear that I am not blaming shelters, but this is really connected to that 85% of people who say affordable housing is always hard to find, or always or often, because if women have nowhere to go, they can't leave, and then there's no space. And so this is a huge, huge issue in the sector. And as I'm going to talk about soon, there is an anticipation of domestic violence increasing during COVID-19. And if it increases and there's already such little capacity, that's a problem, essentially, to be.
Yeah, wow, Leah, sorry, I'm just going to jump in here. That's shocking to me. So thank you for bringing that up.
Yeah, and I mean, so one thing to keep in mind, the turnaway rate is based on requests of shelter, not an individual woman, because one woman may contact 4 shelters, right? And each of them would count that as a request. So it doesn't mean 75% of women are being turned away, but regardless, it's too high. And it definitely indicates, a need for more shelter capacity in the sector.
Definitely, yeah.
Yeah. Awesome. So it's not all bad. I want to highlight some of the strengths as well, of course. And the sector has a lot of strengths. And so I've really just put a few down here that relate specifically to some of the COVID-19 stuff that I'm going to get into. And so some of the strengths heading into COVID-19 are existing pandemic policies. A lot of shelters already had either pandemic policies or kind of emergency preparedness policies that they could activate, so that's helpful. And we have a few samples in the Google Doc I mentioned, so if your shelter doesn't have one and you're looking, you could look there. There's a lot of creativity in the sector, partially out of necessity because there's so little funding, but it's a positive in a lot of ways because it means shelters are really used to adapting and being creative, which is helpful in a changing context like this. And then, of course, there are strong existing networks, locally, provincially, nationally, which mean that shelters, they're not responding on their own. They're able to connect with, other shelters in their city or their town, their provincial association, if they have one, us at the national level, which is helpful. So that's sort of the sector situation. And so now talking a bit about the domestic violence situation related to COVID-19. And I do want to emphasize that it's pretty early, in a sense, to have kind of a definitive trend or statistic, but I'm definitely going to highlight a few things that we're seeing. So if you're kind of interested in some background information or context on some of the ways that pandemics can be linked with violence against women and children, there is a working paper that was put out by the Center for Global Development. And they kind of looked at the literature on, what has been the connection between past pandemics or disasters and violence against women and children. And they identified 9 different kind of pathways or factors that can impact violence against women. And so some of them are probably not surprising. Things like, economic insecurity. Obviously, there's a huge amount of people who aren't employed right now, which can increase occurrences of violence. Quarantines and social isolation. Women may not have the ability to leave. They're kind of stuck in a situation with their abuser. Some of them are less clear. So disaster and conflict-related unrest and instability feels like it doesn't connect to a pandemic, but the authors pointed out that in fact, some of the disruptions that are happening right now are actually just similar in a way to what might happen in another situation of disaster or instability where, for example, transit systems are disrupted. So that makes it harder for people to move. We know Greyhound has, I think, stopped most of its routes, if not all, and things like that, right? So it could be hard to move around. So yeah, there are some similarities there. Exposure to exploitative relationships, if you don't have the chance to go to work or to school or wherever. Reduced health service availability and access to first responders, so people who might be able to help you, connect you with supports, notice that something's going on. Virus-specific sources of violence is a big one. So abusers may be using specific tactics, threatening to infect someone, isolating them from their children, for example, because they're saying, oh, like you're going to infect them. Anyway, so some specific kind of manifestations of abuse. The inability to temporarily escape when someone goes to work or something like that. Response efforts, it's a little early, I think, to know what's going on with that, but something to watch. And then, of course, most healthcare workers are women, is what we have been learning through this, if we didn't know already. And so violence in that context is something to keep an eye on. So then looking specifically at domestic violence, what are we seeing around the world? Because a lot of countries experienced COVID-19 earlier than us here in Canada, or they may have experienced it harder than we have up until now. And so some of the reports from those contexts can be illuminating. So in China, in Jiangxi County, police have said that they received 3 times more reports of intimate partner violence in February 2020 compared to February 2019. In Australia, a survey of about 400 frontline workers in shelters indicate 40% of them said that they'd seen an increase in calls for help, and 70% said they'd seen an increase in the complexity of the cases that were coming in. And in the United Kingdom, The Guardian has reported that femicides have doubled during the pandemic. So those are pretty stark facts. And then looking at the situation in Canada, it's a lot of stuff is anecdotal at the moment, but anecdotally, we are hearing about from some shelters an increase in calls or an increase in kind of contacts being made, an increase in the severity of violence in some cases. We're also hearing from some people that it's quieter than normal. Fewer women reaching out, fewer women in the shelter. And that's not a good thing, because what that means is that women are having trouble reaching support, because domestic violence definitely hasn't disappeared. So it could seem contradictory, but it's happening differently in different places. None of those things are positive, I would say. And other things we're hearing, police forces indicating an increase in domestic calls. We should be careful about that stat because the way that that's defined at the police force level versus the way a shelter might define kind of a domestic violence incident might be a little bit different, but worth noting. And of course, the Battered Women's Support Services have tracked 8 cases of women killed by current and former intimate partners between April 1st and May 4th, plus the Nova Scotia mass shooting, which started with an incident of domestic violence. So I think one thing to highlight about that is that 8 cases in a period of about 5 weeks is more than normal. And so last year, the stat was a woman is killed by a current or former intimate partner every 6 days. And so 8 women in about 5 weeks is definitely more frequent than that. But again, it's hard to compare kind of 5 weeks to a whole year. So, caution with the stats, but I think these are really important indicators to be looking at. And so for those of you who said you do work in the VAW sector, I'd love to know what you're seeing. So there's a poll here too, and you can let us know what you're seeing. Are you seeing an increase in calls or in severity? Is it quieter than normal? What's going on? Because it is really different everywhere, so it's kind of interesting to know. Give you a few seconds.
Yeah, it is interesting. Thanks for bringing this up, Leo. As we give people a couple seconds just to respond to that, just take stock of maybe if you aren't in the sector specifically pertaining to violence against women or intimate partner violence, what has your life and what has your practice kind of looked like? Has there been an increase in kind of crisis calls? Has there been an increase in requests? And you can let us know in the comments as well, even if you're not in the sector specifically. Yeah.
Totally. And I think there are a lot of parallels in other sectors. Like I know in the first poll, quite a few people said they were in the mental health sector. And obviously there's huge increases, probably, I would imagine, it's not my sector, but in the amount of people seeking out mental health supports. So definite similarities, I'd imagine.
Yeah.
So let's take a look at some of the results. So yeah, so definitely kind of an increase in calls, increase in severity is pretty huge. So that's really interesting. And about the same with quieter. So that is kind of representative of what we've been seeing across the country is for every place that says they're busier, there's somewhere that says they're kind of alarmingly quiet, which is interesting.
And I think that's a good point that you say, like alarmingly quiet, right? Because it feels, we definitely, and anyone who attended our webinar on protecting children from child abuse amidst the COVID-19 pandemic, we know that there's some times when we're going, we don't think that it's because cases have decreased. And instead, we need to start thinking about why are we not seeing this reporting and or access to the services that we need. So always trying to be cognizant of that, even in whatever sector you're in, being cognizant of that quiet time might not signal that it's decreasing, and instead that they're struggling to access services.
Exactly. That's exactly it. And that's a great segue to the next section. So how are women and children accessing services right now? Or how are shelters facilitating that? So let's jump right in. So for each of these kind of focus areas, I'm going to talk about first some of the challenges that COVID-19 is raising, and then how shelters are adapting, and then some of the considerations that are kind of being raised by those adaptations or things to think about. So in terms of women accessing shelter, so reaching out for support, that kind of thing, the challenge is that previously most women would have contacted shelters by phone. And they might have done that when their abuser was at work or out of the house for some reason, or when they were at work or out of the house. But with COVID-19 restrictions, many women are probably sort of stuck with their abuser and not having the opportunity to leave their house, maybe not having an opportunity to make a phone call without the abuser overhearing. And so that's a huge challenge. And then on the outreach side for women who maybe are former residents or kind of doing outreach in the community, in-person follow-up is obviously not feasible at the moment because of distancing guidelines. So the adaptations, I would say a huge focus has been finding safe ways for women to contact shelters when they're at home with their abuser. And so there's been a lot of shelters trying to kind of put together crisis lines that aren't phones. So by texting, web chat, putting like a panic button app on their website. Bryony House in Halifax, I believe, has done that. And there was a kind of a group of organizations in Ottawa that created the Unsafe at Home Ottawa chat platform, I guess, for women to reach out to services. So yeah, that's been a huge focus, is trying to find ways that a woman could contact the service without having to talk out loud, essentially. And then for outreach or for ongoing support, using alternative methods that aren't in person. So virtual things like Zoom, Facebook, Skype. Also for offline, writing letters is something I've heard, which I thought was really interesting, because of course lots of people don't have consistent access to the internet, or maybe they're not super comfortable with platforms like Facebook or GoToMeeting or something like that. And so, you know, writing a letter is a great way to stay connected and just provide a little bit of connection for someone who might be feeling isolated. So some of the considerations raised by these adaptations, a huge one with the use of virtual platforms is security and privacy, confidentiality, making sure that using these platforms, you're doing it in a way where the data is going to be secure, the woman's privacy and confidentiality is going to be maintained. So the BC Society of Transition Houses, which is sort of the provincial association for shelters in BC, has great resources on this. So they have a digital services toolkit, and one of the things they have in that is a comparison chart, which compares a bunch of different platforms on cost, what they offer, data security, privacy regulations. And so it's a good, helpful tool if you're looking for, you know, a platform to use for remote counseling or anything else you're trying to do remotely, basically. And then aside from, you know, which platform do you pick that's safe, how do you make sure women can access those platforms and use them? So things like, do they have the technology? Maybe getting loaner iPads, loaner cell phones that they can use. Purchasing data plans for women who don't have them, or paid accounts to things like Zoom, because sometimes the paid account will have a slightly higher level of security than the free accounts. And so some shelters have been arranging sort of paid accounts that their clients can access. And then, like I said before, using text messages, using letters to connect with people who aren't comfortable with technology or don't have access to the internet or a ton of technology as kind of an alternative method. Another thing to consider is that communication does happen differently on those platforms. And so, you know, if you're texting especially, I mean, we all know this, you have a lot shorter conversation. There's not as much nuance. You're not getting the body language, the nonverbal signals. And it can, with, you know, the situation right now, outreach is kind of happening maybe at a different time of day than it would have before. So maybe not during kind of the workday, maybe it's outside of the workday. It's different for everyone. And so shelters are kind of adapting their communication style for that. So thinking about different types of questions to ask, maybe a lot of yes/no questions, so that if someone is within hearing distance, they're not getting what the conversation is about. Changing the hours that staff work to respond to kind of new high volume times, and reallocating staff from programs that have been canceled because they're in person to these new kind of text lines or new forms of support that are being put in place. So then moving on to, you know, when a woman does need to enter shelter, what is happening with that? And so the challenges, I've kind of alluded to these already, but the challenges that most shelters are a communal living environment. And so it's pretty hard to put in place distancing measures in a communal living environment, essentially. And so what are some of the things shelters are doing? They're adjusting the way physical space is used. And so, you know, restricting the use of common spaces, maybe setting up rotations so that, you know, each family can use the playroom for whatever, half an hour, and then it gets cleaned, and then another half hour, and that kind of thing. Providing meals to limit kitchen use. And so some shelters have always been providing meals. Other shelters, they provided groceries, but women would do their own cooking in the kitchen. And so now, to kind of avoid that, a lot of shelters have switched to providing cooked meals. And of course, cleaning protocols. That one, I'm sure, is consistent everywhere. Another thing that's really come out, though, is the use of alternative locations for sheltering, so locations that aren't the shelter itself. And so that's being used either for isolation, if someone does need to do kind of a 14-day quarantine, or anyone coming into the shelter, if they need to do a 14-day quarantine before entering the communal environment, they use it for that. It could be to reduce the number of women in shelter. So if you would have had 20 women before, and 2 of them would share a bathroom, then maybe you have 10 in the shelter, 10 somewhere else, so that everyone has their own bathroom access, basically, as an example. Or it could be in cases where a particular individual would have trouble following some of the restrictions around staying in the shelter unless it's essential, that kind of thing. It could, maybe someone is an essential worker, they don't have the option of staying put, they have to leave the shelter, and so how to do that in a way that doesn't endanger other people in that communal environment. And then, of course, overflow capacity, because like I said, shelters are very much at capacity often. So somewhere else for women to go. And the considerations here is that if you're using an alternative location, and so that could be something like a hotel, a residence, there's sort of different options people are using. They aren't built with those security features that a lot of shelters have put in place. And so to get around that, shelters have been making sure that the women who stay there have phones or have panic buttons, some way to reach out to someone at all times. The highest risk cases would be staying at the shelter, perhaps, rather than somewhere else. And making sure there are some security measures in place. Maybe that's hiring security. Maybe it's just making sure that there is kind of a clear confidentiality set up with the alternative site. It would look different everywhere, I think. And then, the logistical things like food, making sure either that they do have access to a kitchen or that food is getting delivered to the rooms. And of course, continuing to provide support, because, and I'm going to talk about this more in the next section, but shelters are not just physical shelters. So making sure there is a staff person on site, even if it's an alternative location beyond the shelter, or making sure that there's sort of a virtual check-in every day with everyone. And to talk more about that, So supporting women and children who are staying in the shelter or at an alternative site, I think it's important to keep in mind, distancing and isolation are hard for all of us right now, but particularly hard, I think, for women who are recovering from trauma. And part of that trauma might have been isolation, because that is a really common tactic that abusers use. And so, having left the situation of violence and then having to enter into another situation where you are having to isolate, can be quite difficult. And so how to make that, doable, basically. And, also then, of course, the piece around continuing to offer services that shelters would normally offer. So there has been a reduction in face-to-face programming, although obviously if it's kind of an urgent situation, do what has to be done. But that doesn't mean programming has stopped. And so a lot of it has switched to virtual and remote delivery, even within the shelter. So for example, checking in with the women daily by phone, even if they're upstairs and you're downstairs, but just to keep that distancing. And then supporting women so that they have what they need to isolate. So like I said, providing food and groceries, making sure there's Wi-Fi connections, making sure kids maybe have a tablet or computer access if they're supposed to be doing school by distance, for example, TVs, just entertainment to pass the time. Because keep in mind, if a woman is in the shelter, she doesn't necessarily have all the things that you would have in your home, right? And in terms of distraction. And so trying to create opportunities for some fun and for some distraction so that it's not kind of a negative isolation situation. So providing games and activities that the kids can do inside, art kits. One shelter, excuse me, one shelter had brought someone in to do kind of an outline of a mural on an indoor wall, and then the kids got to go kind of family by family, have their turn going out to fill part of it in painting. So that's a fun thing, and obviously, you know, art can be very emotive and therapeutic as well. And then virtual group activities that you might have done in person, but seeing if you can do them on Zoom or something like that. So virtual art classes or music or something, and finding time for there to be special occasions as well. So maybe there's pizza nights on Friday or something like that. And obviously same considerations apply about privacy, confidentiality, all of those things. So just to kind of wrap up here, I did just want to flag a few things that I think are going to be things to watch over the next few months. One of them is as we start reopening society, and there is a little bit more mobility, a potential surge in demand. And so all the women who couldn't reach out or were concerned about reaching out during COVID-19 now reaching out, and how to deal with that kind of surge in demand. As well as adapting to the new normal. And so, you know, society as a whole may be reopening, but what does that look like in a communal environment? And, you know, if kids start to go back to school and then they're coming back to this shelter environment, you know, how do you manage that? And so thinking about the ways that reopening might look a little bit different in a shelter than they would for sort of a one family household unit. And how to sustain that over the long term. There has been some emergency funding for VAW shelters, but fundraising may be impacted for months because of the economic situation, and some of these adaptations are costly, and so just making sure that can be maintained and continued. And I just want to wrap up with a huge thank you to everyone who's working in a shelter, to frontline workers in every sector. Shelters have made huge adaptations really quickly to be able to continue offering support to women and children. And so I just want to kind of wrap up with an acknowledgement and a thank you for that, for all the people who are doing that work. And I would love to take your questions.
Amazing. Yes. A huge thank you to all of our social workers and our frontline workers. Huge thank you to Leah and all the work that your network is doing as well. It's really incredible to see how much everyone has come together to try and keep Canada's, you know, vulnerable families safe. Well, not even just vulnerable, Canada's families safe. So thank you so much. So we do have a lot of questions. Please type your questions now so that we can try and get to them. You can use the question and answer box on your screen. We have, like I said, about 15 minutes for question and answer. So that's amazing. Thank you for all of your questions that have come in now. I'm going to dive right in, if we don't mind. We did have some questions about the COVID-19 specific funding that came out that the government had announced in terms of the monies that were going to addressing violence against women and shelters. Have you found that this money provided is relative to the need? Can you expand a little bit on that?
Yeah, so Women's Shelters Canada was actually, or is responsible for distributing the chunk for VAW shelters outside of Quebec, and not the shelters funded by Indigenous Services Canada, because they're receiving their funding through them. And so most shelters have received their kind of initial amount of funding through the emergency funding, and then there is a second funding round that has actually just opened, which is for shelters that have additional needs. And so you know, the whole thing is a balancing act between making sure everyone gets some money quickly and also making sure needs are being met. And so the first round of funding, kind of the base amount that shelters received, was did take into account kind of how many shelters your organization runs, do you have second stage units and that kind of thing as well. And then to meet needs that weren't met in that first round, there is this second round. So, you know, I mean, hopefully that does meet some of the needs that are out there. As I flagged in my conclusion, though, like I think this is just the beginning of the COVID-19 response. And so I think over the next 6 months, 12 months, the situation is going to continue to evolve, and the needs will as well.
Yeah, excellent. I definitely think, and something that we've been trying to be very cognizant of at the CSW is that we're not really sure what will happen after the kind of emergency measures conclude and provinces begin to start reopening. Maybe some people start going back to work and or school, and then we start to really see kind of what happened during that period of time. So hopefully there continues to be supports as we move into this post, emergency lockdown kind of phase.
Exactly. Yeah.
Awesome. Okay. Another really good question. A lot of people who actually work in the disability support space. So I don't know if you're able to provide any kind of comments on maybe what it's been like for women. I know you don't do any frontline work and you're not necessarily in the shelters, but have you heard anything about what this impact has been like for those with a disability and those who are also fleeing violence, as we know that there tends to be higher rates for those who have a developmental and or just physical disability?
Yeah, so I haven't heard a ton specifically related to the pandemic, although I think it is fair to assume, obviously there are lots of existing inequalities that affect who experiences violence, what severity of violence do they experience. And those, I would imagine, are being exacerbated by COVID-19. We know already that, COVID-19 itself is not equally felt among the population. It's sort of being felt more by various marginalized groups. And so I think it's fair to assume that that kind of inequality is being exacerbated. On a more general note, I guess, about that, the report that I mentioned, the More Than a Bed report, which I would, recommend people look at if you're interested. But there is a section in there on accessibility at shelters and in the shelter context. And, shelters do what they can, but there are constraints and in terms of the physical space that they're in. And so it is a challenge that shelters are grappling with, is how do they make sure that there is sort of an accessible space in their shelters for women who have various disabilities. And some shelters have been able to kind of retrofit or do renovations or, shift towards low barrier services that maybe accommodate different women more effectively. And so, that work is definitely ongoing. And again, not spread evenly throughout the country, which is one of the reasons that the National Action Plan is so important, because it's, smaller shelters have less funding, less room to make those retrofits. Rural shelters, things like that. And of course, there are different circumstances. If you're in a rural area, you don't necessarily have paratransport. I don't know what it's called in other cities, but public transportation that can help you get somewhere you need to go if you don't have a car, right? Or you can't drive or whatever. So I don't know a lot about the COVID-19 specific impacts, but I think it's fair to say that those existing challenges are only going to kind of deepen.
Yeah. And I don't think anyone really knows, to be honest, what the impacts are. And I think it'll come up a little bit more as we start to unravel the situation itself. But taking a moment, and if you're someone that does work in any kind of shelter space, trying to put a disability lens on if you haven't already, and try and think of, some of the different ways you can be supporting those who are who have a disability. It's funny that you kind of, I feel like you already addressed this a little bit, but another question that just came in was maybe like any intersectional reflections that you can have on maybe what the impact is in terms of intersectionality, and then even specifically what about for trans women, and what has been the conversations coming from, the increased funding to address trans women? Yeah,
for sure. So yeah, I think in terms of intersectionality generally, sort of what I've already said, just in terms of, I think the existing inequalities are getting worse. Like COVID is not helping. And so, thinking about things like women who are in rural and remote areas and Indigenous women face far higher rates of violence and more severe violence. And we know that already. And so I think it's fair to assume that would continue and perhaps get worse.
Yes.
And I actually had a note on this, but I forgot to mention it, I think, earlier. But, when you're thinking about accessing shelters right now, too, let's say a newcomer woman who doesn't speak English, does she have access to someone who could contact a shelter for her right now, right? Maybe she would have had a friend help her out, have a coworker. And so maybe that support isn't there right now. And so if you don't, if you're not kind of speaking the majority language in your area, that's a whole other set of barriers. And so, there are various barriers that exist in normal circumstances that we can think about how the COVID-19 restrictions are impacting them specifically. In terms of trans women, everything I've just said, but also, also I would just point out or highlight, I guess, maybe for people who are interested in this, that Women's Shelters Canada has an ongoing community of practice on supporting trans women, or supporting shelters to support trans women, basically, and kind of becoming more open and accessible and inclusive. And so we have some resources on our website in terms of practices other shelters are using, and sort of their experiences with this. And there's kind of, like I said, an ongoing community of practice with webinars every few months. So if it is something that you're interested in looking at, if your shelter is kind of thinking through, do we need to make any changes? How can we make our space sort of safe for everyone who might be experiencing violence? Then those might be helpful to look at.
Well, that's excellent. I know a lot of our members love to have any kind of resources that they can not only peruse themselves, but take back to their agencies and their workplaces and share with peers and colleagues. That brings me to another point that I just wanted to quickly mention. For anyone on this call, please note that the CISW has launched a peer-to-peer support group as well on Facebook. You can find that in the resource section of your webinar platform on your side. And you can request to be a member of that to share your expertise and knowledge about what you've been seeing during COVID and provide support to others, as well as hopefully get some support for yourself, some ideas and expertise. So I just wanted to make a little note of that before I get into my next question. So I had it up. One of the conversations is about one of the questions is about human trafficking. So wondering if you've seen an increase in terms of, or if the shelters that you've spoken with have seen an increase in human trafficking or a decrease because we're not able to access, again, like those spaces where a lot of women may be receiving support and or services. So, any kind of insight you can provide on human trafficking specifically would be great.
Yeah, unfortunately, I can't provide a lot of specific insight. So, yeah, but I think, a lot of things right now are being driven more underground than they may have been already. And so I think if, someone in a domestic violence situation is having trouble accessing a shelter or making a phone call to a shelter, I think it's fair to say that probably people in human trafficking situations are also probably facing challenges accessing supports. A lot of programs that might specifically support survivors of human trafficking, I don't know specifically, but a lot of programs generally have had to shift the way that they operate, right? And so maybe they have had to cancel some programs, they've had to switch to a different location that does allow them to do physical distancing more effectively. And so what that means is that even if those services are open, they may not be accessed in the same way that they were before. And so if you're not aware of that, or if you're just looking for a service now, it could be quite hard to figure out how to access that. And then I think, the concerns around funding certainly apply to everyone. And I don't think that there has been a lot of conversation around specific funding to support shelters or organizations that work specifically with human trafficking survivors. And so that's potentially a conversation from a funding perspective that needs to be had to make sure that they're also receiving a lot of support in the same way that a shelter that sort of predominantly works with domestic violence survivors is getting support. So Not a lot of specific information, but
yeah, totally. Just, as this kind of conversation we're all having, I think there's about 70 people on this call, so we're all just having it. Please type your questions. We do have a couple more minutes, so we can get to a couple more if you do have any. I'm wondering if you've heard anything, and again, this might be another, I feel like I'm throwing you some pretty hard balls here, but I'm wondering if you've heard anything in terms of people and their pets. Oftentimes shelters, have to come up with different arrangements for people's animals. So have you heard anything about that at all?
I think, the programs, so there are, the first thing I'll say is that we run a website called sheltersafe.ca, which is a tool that women can use to look for shelter near them or in the area they want to go to. And one of the things that we indicate on that website is you can search near you, the shelter icon will pop up, and you'll see their phone number, for the crisis line, potentially an email contact, whether they're first or second stage, are they wheelchair accessible, and also do they have a pet sheltering program? And so some shelters do have pet sheltering programs. Other shelters have partnerships with organizations like Pet Safe Ottawa and the equivalent organizations in other communities, where if a woman is coming into shelter and has a pet, they will arrange for her pet to be taken care of while she's in shelter if it can't be at the shelter. And so I think those organizations continue to operate. And so, that shouldn't, that's a message to kind of get out there to people, is that if that's something that's holding them back from accessing shelter, is a concern about what will happen to their pet, because we know that is a concern for a lot of women. And one thing that can make them hesitate to come to shelter, that there are programs that are helping with that. And those programs, like shelters, continue to operate.
So that was, you said it was sheltersafe.ca?
Yeah.
Excellent. I'm just going to push that to the audience for anyone who is curious about that, because that is an excellent resource. One thing I did want to note as well is the CSW has also launched a domestic violence resource page. So you can access that if you are either someone looking for support and or a practitioner and social worker looking for any kind of additional resources. We'll be putting this webinar up and any resources provided from our friends at Shelter Network Canada. But just so everyone knows, I've got another great question about maybe safety plans that are COVID-19 related. Any kind of comments or insights into safety planning?
Yeah, so the Google Doc that I talked about, we do have a few documents on there from other organizations that they've put together with some safety planning tips specific to COVID-19. So that's sort of one place to look. I think the VAW Learning Network, which I believe is based out of the University of Western University, I don't know. Anyway, Western. And so they have put out a few different infographics, and I believe one of them is looking specifically at safety planning and taking into account kind of the specific abuse tactics that might be used right now as well. I think a lot of things, or a lot of the techniques or the practices being used would still be similar, right? They would be kind of the same, but the solutions or the responses to keep oneself safe might be a little bit different given the situation. But I mean, obviously, well, I'm sure I don't need to say this to anyone on this webinar, but the priority, or one of the priorities in terms of communication and messaging from shelters right now is just to make sure that, this is a particularly important time. It's always important, but particularly important right now for families, for friends, for neighbors, to be kind of paying attention to what's going on around them and with their friends and with their family members who might be in a difficult situation. And so it is kind of a time to check in on each other and help with access to support if that's useful and helpful. And so the VAW Learning Network also has some resources, some infographics and stuff on families and neighbors who might be trying to support someone at this time, which are also useful resources.
And those are excellent. Yeah, like you said, excellent resources for anyone, not just, social workers. Yeah, we had we had Dr. Michelle Ward, who focuses on, she's a pediatrician and on maltreatment And what she said is, it's going to take a village, albeit virtual one, right? And yeah, so I think that a lot of these resources that we're offering are not just for social workers, not just for shelter workers, but hopefully that we can be those kind of conduits to take these resources and apply them into our, general population, because we are going to all need to be a lot more alert and heightened right now to start recognizing the signs and starting to help.
Yeah, and I think that is particularly important right now because, that was, one of the pathways to violence I highlighted earlier was less access to supports in healthcare systems, first responders. And so, where someone may have interacted with a social worker at school, or they might have seen their family doctor regularly, or, these interactions with a professional where they might have been able to access support, those might not be happening now. And the people they may be connecting with are family, are friends, people who don't necessarily have that kind of professional repertoire to pull on in supporting them. But I think getting that messaging out there so that, that village, virtually or however, can kind of, step into that and, try to help out, try to connect, sort of feel a little bit more comfortable knowing what to do if you've seen some of those resources or some of those suggestions. So I do think that kind of public awareness piece is a huge part of the battle at the moment, really, that shelters are kind of trying to get out into the community.
Definitely. So we just hit an hour, so I'm going to try and wrap this up. It always seems to fly. Especially in the Q&A. So if we didn't get to your question, I'm so sorry. Please let us know either on the Facebook group, and we will try and answer it the best we can, or on Twitter, or any way that you normally connect with us in the CSW. This live event will convert to be on demand. You'll get a link sent to you in about 24 hours, but you can log in, give it about 20 minutes, and you'll be able to log back in and rewatch, or send to anyone that you think might benefit from this webinar. Huge thank you to Leah and to everyone from Shelter Network Canada. Thank you so much for taking your time out of your busy schedules, and not only facilitating this, but all the time spent organizing it and everything. So thank you so much for putting this on for social workers. Just a couple little wrap-up things for all of our members. You're going to access your certificate of attendance in the bottom widget. If you logged on a little bit late and didn't hear our introduction, you can also access the peer-to-peer support group on the resource section as well. Anything from here you should be able to download and take with you and watch again, and we hope that you do. We hope that you all stay safe and healthy. And yeah, thank you again, Leah. Thank you so much.
Yeah, thank you. It's been great. Really enjoyed it.
So let us know if you need to get in touch, or else enjoy the rest of your day, and we will see you next time. Bye-bye.